Mm. Hello, everyone. This is Tara Livingston, and I'm trying really hard to go on to YouTube and have live interview uh, with Erin, who's lovely and also suffers from Foreign Accent Syndrome, or maybe not suffer uh, of this. Maybe it's in a good, it's we have a giftedness of this. I don't know. Maybe could be happening. Could be happening. I'm very happy that you're joining me, and hopefully Erin is getting better or getting into here. Oh, I think she might be coming. Just a minute. Here she is. Oh, look, there's an Erin. Look at you, beautiful. Oh, are you muted? You're not speaker. There's no speaker. I can't hear any sound. But I see lots of beautiful you in the screen, but I don't hear any voicing. Do you know where the little microphone that says in the bottom left corner? And has it been unmuted? Can you hear me? No. Oh, this is problem. Oh, thank you for being patient with all of me people here. I don't know what's happening. You're using a phone, right? Let me see, chat. Are you in the phone? Is the mute on? You can't. I don't know what is happening here. Let me see. Make host. I don't know. I can't hear your sound.
Oh, can you hear me now?
I can hear you.
Ah,
Can you
okay.
hear me?
Yes, I can hear you now. All of a sudden it says click for audio. And
Oh.
I'm like before it said, we're trying to get it so I don't have to hold the thing. The tripod's too short.
Oh, yes, I understand, but I love your background. That looks beautiful today.
Yes, that is a window that I made of an iris farm in Duncan, Oklahoma, where I live.
You made this art for yourself.
Yes, I bought a farmhouse window and then I blew up this photograph that I took on my phone and made it into 6 10 by 12s and spliced it together.
That is so creative. I have no artistic idea. Listen, I've been trying to make this live video happen. Now you're going to watch me my hair dry. This is what's going to be.
That's what my hair is on today.
You look very beautiful today.
Thank you. I tried to give you some color because the other day this box is like collapsing on one corner and it's making the whole thing crooked.
it's all perfect, Erin. Thank
That's
you
okay.
for doing this for me. Foreign accent syndrome. Have you, before you had it, did you ever hear that before? Heard about it?
Uh, yes, I think I had heard that there have been people that wake up one morning and then find out that they're speaking another language, but this is not the same thing. We're still speaking our same language, but we sound like we're from a different place.
Oh, yes. Now I want to ask you, okay, I'm supposed to be the very professional interviewer right now. I have an agenda. Can
Yes,
you, Erin, you tell me what is your life? So were you born in California?
yes. I was born in Los Angeles and lived my whole life in Huntington Beach.
Oh my good, that's so beautiful. I've been there before. Uh, yes, it's
I love it
beautiful.
there.
Yes, well, yeah, it was very good weather because I went in February. So it's very cold in Calgary at that point. So you and where are your parents from? US or I mean
Yeah,
America?
yeah. Well, my mom is first generation on her mom's side, American. Her mom was born in Poland.
Okay.
Um, but I never met any of my grandparents. They all died before I was born.
So
And
you weren't influenced by the by Polish accent or anything.
no, as a matter of fact, my mom only met her Polish family a couple of times. They all lived in Chicago, and my family lived in Los Angeles. And you know, that is it. So we grew up mostly with our Irish family. And they're yeah,
Oh, wait, say the word Irish again. You say this again.
they're Irish.
See, you sound everybody every time I listen to you, sometime couple words sound Irish.
It depends on how many R's are in the word.
Oh, it's all the R's.
It's the R's. And one of our friends, his wife had just passed away, and he's 80 years old. And I was sitting next to him at the party. He goes, "Oh my God, your R's, they're straight out of Ireland. You can't fake that." And he's like, "Sit next to me. You remind me of my Dorothy." And I said, "Jeff," I said, "Frank thinks he likes my R's." And he goes, "Oh," and it turned all red. He goes, he goes, "In Ireland, we call your bum an arse." And
Oh, it's right.
I said, it was just the way the arse come out, and
Oh,
to try and say two of them together. And he just turned bright red and kept giggling. It was really funny,
that
but and very sweet. But I have not spoken to so many Irish people. I've been to Ireland, but that's about it. And the fact that I say a lot is part of our FAS. Hang on one second.
yes, I understand. When did you go Ireland before your accent started?
Oh, yes. I mean, we took my mom after my dad passed away. We took her for her 60th birthday. So it's been 24 years since I've been to Ireland.
Right. So so you sounded like anybody else from California.
I did.
Yes.
And until about 8 years ago.
Yes.
And there was a severe allergic reaction to a spray in the hospital, and I couldn't breathe. And they took me to the emergency. I was there because my husband had surgery. They took me to the emergency room, and afterwards, I had such a hard time speaking, like everything swollen in my jaws and in my face and everything. And I sounded like a deaf person talking, or maybe a Downs person. And I was sent to vocal cord specialists and speech therapy. And
Yes.
because one of the biggest problems was I could not say the letters of my name. You know, we call people and you have to make doctor's appointments, and I can't say E's and I can't say R's. And R's was one of the letters I couldn't say. And the speech therapist, she taught me exercises so that I could say certain things and how to enunciate more so I'd be more clear to other people. But
Yes.
she said she had me say the letter A into her computer for as long as I can. And I
Yeah.
sound like Tarzan. And she said, you have over 30 spasms in 30 seconds. She says, I don't know how to fix that. I don't know how to teach you how to overcome that when you're having all these spasms in your vocal cords. And so
Oh, so you were, I want you to say more about this. The spasms of the vocal cords. I have learned some for you, but first I want to start with question.
okay.
So clearly you're faking this, right?
I actually have been to so many specialists, and two said absolutely not genetic related.
Right.
Two said absolutely has to be genetic related because I have dystonia, which gives me the full body muscle spasms and includes my vocal cords and mouth. And
Yes.
because of that, they said that they have never seen somebody who had the dystonia, which is what the general dystonia, which is the full body muscle spasms. If they had the accent, then it was a genetic form of what I have.
So so is it the genetic component is the genetic part, or is it the accent is genetic?
Well, they're saying they've never seen somebody with this condition that if they got the accent, because most people, there's like 200,000 people a day who get this condition, but there's only like 200 of us in the world that have FAS. And they said of the people that they get with this condition, only the people that have a genetic form of it have the accent as well. They may have all other body spasms and things, but they will not have the accent. So 99.999% of those people do not get the accent from my other condition.
So okay, so you're not faking this, but do people think that you are faking?
I went to one quote unquote specialist for my condition, because my neurologist in Oklahoma found that there was a specialist in Oklahoma City, and he was kind enough to tell me that I taught myself how to talk like this. And
Oh
I
my
said,
God.
I mean, after 8 years.
Can you? So because now clearly between us, just you
Yes.
and me, Erin, just admit that when you're just home with your husband, you go back to speaking normal.
No, but it's really funny because I don't think about the fact that my outgoing message on my voice thing on my phone is my old accent. And one of my friends called one day and goes, "Oh my God, it's you." She goes, "Oh my God, I shouldn't say that." She goes, "But it's you. I hear you now, and I have gotten my voice back for as long as like 48 hours." And
Really?
yes, so because it did tell me when I looked into it and read all this stuff when it first happened that you can they don't know what causes this condition, and 10% of the people have it go away just as mysteriously as it showed up. And yes,
I have little bit hope. I have to say that when I wake up in the morning, I do my coffee, I brush my teeth, and I don't, I think in my own voice, my old voice.
Well, of course.
Yes. So every day until I speak, I think maybe today is the day that I'm going to be cured.
When I called my mom, when I got my real voice back, and
Yeah.
she almost started crying. She goes, "Oh, I can't believe it's you." Now, I talk to her at least once a week, sometimes more, but she does not associate this accent with me, even though now it's funny. Even when I go home to visit to California, because I live in Oklahoma now, because I call her mom, and the way it comes out, it sounds very British, you know. And
Yes.
so she's like, she mimics me saying certain words, trying to get used to my accent, you know. And the thing that's ironic, she's terrible with accents. She cannot understand me sometimes at all. And
Yeah.
I say it as clearly as possible. And so then I'm playing charades with words, trying to find other words so that she knows what I'm trying to say, because she keeps saying the wrong word, like, "Oh, you want to talk about this?" I'm like, "No."
Yes, this I'm very interested. When you were growing up,
Hmm.
my experience was, I used my son. Sorry, I also have aphasia, so my words are confused. Um, my brother and we used to play around with accents, and I want to see if I can say if I say this phrase that I used to say when I was child. Wait, please, sir, may I have some more? And then, right? And so that was
I was just saying that last night.
so just please, sir, may I have some more? So I could then I could go into an English accent. And
Yes.
so I've had people ask me if somehow I started doing this myself, and then
Yes.
I just got stuck. It's so silly.
Well, yes. I mean, my brother loves to do voices, and his whole life, he would want to do voiceovers for cartoons and stuff like that. And he
Uh,
likes to do Scottish accent, Irish, whatever. Anything. He likes to be the center of attention. I was the quiet one,
oh,
and
that was me too.
I was not the performer. And this has been interesting because everywhere I go, and my sister and my husband, they get tired of it. And it's funny because even at the doctor's office, I talk to the receptionist while I'm waiting to go in. And everybody who comes and asks about my accent, she goes, "Can I tell them?" She goes, "I'm not supposed to tell them because of HIPAA, things." She goes, "But can I tell them?" I said, "Yeah,
Yes,
you can tell them. That's fine."
yes, it's
Because
right. Yeah.
it only one person, no, not one, but only a few people said, "Oh, I didn't know that people from California had that accent." And I'm like, "Really? You don't watch TV? You've never seen anybody from California speak except for me right now?" And I'm like,
That's
"No,
very
they don't talk
funny.
like this."
Yeah, there's very I can understand, no, I can uh tell different accents. I want to tell a little bit story. I was traveling in Israel for a long time ago, and there was two very young men with backpacks with Canadian flags all over,
Right.
little pins and on their backpacks and everything. And they started talking, and I'm like, dudes, you guys are from New York City.
Yeah.
But
I-
they
well,
couldn't tell the difference in the people who live in Israel. They couldn't tell the difference
no, they
between New
can't.
York City and us. And I was like, uh, anyway, it was very silly. But
It's actually, I backpacked in Europe for 2.5 months and went to 8 countries. And Yeah, we met a lot of Americans along the way who would put Canadian patches because they said they're not controversial like America. And I'm like, yeah, I would just not, if you don't want to put something on, don't put something on, but put on the wrong one on purpose, whatever, you know. But
Yes, but I have
yes,
to say that as Canadians, we're a little bit proud of the fact that Americans go and as camouflage themselves as Canadians because we just have a better neutral a reputation in the world, right? This is
yeah, I mean,
we used to in Canada, we used to go to Cuba for vacation because there was no
yeah,
Americans. It was the only place that Americans couldn't go.
yes. And I was in Turkey. I traveled in Turkey with my mom in 2000, and we were there for a month, but everybody assumed I'm German. One, because I'm fairly tall
Mm.
and blonde, and apparently a lot of German tourists go to Turkey. But I did not want to speak. Well, I didn't have an accent then either, but I didn't want to speak to them because I didn't want they kept speaking to me in German, thinking I would answer, but I'm like, I don't understand. I don't speak German. I did take Spanish, but I don't know if I can even say some of these things in the right accent with this accent. Like when this first started, and I went to the Hollywood Bowl with a bunch of family members and friends. And one of my aunt goes, "Oh, are you going to do Russian accent for us today?" I'm like, "I am not doing accents. This is not a this is not a game. I'm not changing it for every situation."
Yes.
It really kind of annoyed me because she knew that I had this foreign accent syndrome, but shortly after the accent kind of evened out and I didn't sound deaf anymore, and we went and I didn't have the R's back then. I got the R's as a result of a TIA in 2020.
Oh my God.
Before that,
Erin.
my accent was still there, but they didn't have the Irish R's to go in. Like I said, the R's only come in certain words.
Yes, I noticed that during conversation. Yes.
But like I said, if the words don't have R's in them, then you don't hear it. But
So
I do get a lot of sing-song because there's so many spasms in my throat. And it's like, they said, the speech therapist told me, she said, it's very little difference to make an accent on the way you move your mouth, but you train your muscles to work that way when you're young, based on listening to your family and so on and so forth. So
I
to
have
have a move completely differently when you're older, it's, born.
I have little, oh my God, I took notes because one of the things my aphasia took is common phrases. I can't
Yeah.
remember it, but I'm going to try this with that uh in the eye of a beholder, right?
Yes.
So this is a phrase. So I've heard this because people can't figure out exactly where first me. How do you answer the question where you're from?
I tell them that I am from Huntington Beach, California, and they all say, even the neurological doctor said, know why I'm there. I say, no, where are you really from? And I like, no, seriously, I really am from there. And I'm like, and you should know because you know why I'm here, you know?
Yes.
But, and I said, but I
Yes.
do have a neurological condition that makes me talk like this, like I'm a
So
foreigner.
those people who have those conversations, how do they classify where do they think you're from or where the accent is from? For me, I say Eastern European. I don't know, like Polish, Russian, maybe Ukrainian.
Yeah.
This is how I describe me. Where do people say the accent is from?
That is where I say the accent is in the ear of the hearer. Until I came to Oklahoma, nobody had ever said German to me before.
Ah,
Now, when I went shopping with my sister in downtown LA, we were looking for fabric for something, and all these people kept saying, "Oh, this is from England." That is just, why do they think? I said, they think I'm from England and that I want something from back home. And she goes, because so she got so tired, and I'm like, no, that's not what I want. But it's interesting because a lot of the fabric merchants that we were talking to were Indian or Middle Eastern. And to them, I sound very British. And I did not have the Arstin. And it's just so, but it's funny. My sister and I, people used to think we were twins. We're 17 months apart in age. And
yes.
We're sitting someplace. My mom we got my dad's coloring. My mom's got olive skin and dark hair and different color eyes. And the three of us sitting in someplace, and I said, "Mom," and the guy goes, "You guys are related?" And I'm like, God, all it took was my accent to change. And now people don't think my sister and I are even related. And before that, they used to ask all the time if we were twins.
Oh my goodness.
And we don't look that much alike either. I mean, there's a family resemblance for sure, but we don't look like twins. People's perceptions are interesting.
I'm very curious because I'm learning so much about talking to other people who have Foreign Accent Syndrome, because just for anybody who's tuning in and seeing this video, I had the stroke in November of 2023, so not even a year. And then I have aphasia and apraxia with speech, and I kept my voice until I had another hospitalization in February and I have theories about what have started with the Foreign Accent Syndrome. So I'm very new because this is 8 years you've been living with this.
Yes. And like I said, initially it was very difficult going to places where people knew you, because they're like, "Why are you talking like that?" My niece one time, she came in from out of town. She was living in Colorado. She was, "Why are we doing this with the voice?" I said, "We're not doing this. This is the way it is now." And but that was when it was really new, and it did not. I still a lot of times would sound like a deaf person talking.
Yes.
And the day that I got the full body muscle spasms, because I told you my spasms worked their way up my body, and when they got to my mouth and stuff, and my mom couldn't understand me when I'm talking to her on the phone, and then I tell my husband, because all of a sudden I became very hard to understand, like, "Woman," I could not. That's what I sound like. And so I wrote him a note, "Take me to the ER. I may be having a stroke." And that's when I told you, sitting in their waiting room, all of a sudden my arm just poof, flies up like that. And I'm like, "Holy crap." And my husband's on this side. And I'm like, "Here, my arm, it's moving by itself. My arm is moving by itself." And by the time, actually, I've started having spasms in there just from doing that. Just from in the 4 hours that I was there, full body muscle spasms. And so I know it sounds funny now, but when I went home and I had to go see my doctor, because like I said, after 4 hours, all of it went away. All the spasms, the voice, everything. And all of a sudden, because my regular voice is a much lower pitch, this is really high compared to my regular voice. And like I said, if I submerge myself to here in the jacuzzi, hot water, and all the muscles relax, I get my regular voice back. And as soon as I come out of that water, it goes back to this accent just that quick. And
I just tell you, I am learning so much about you because I went to with my recreation therapist to the pool. And so we were like half hour and then I was like, oh, maybe I should go this to the hot tub because
Yes,
I've heard you said this story. So now first I should say I'm not supposed to be in hot tub for very long because of a stroke. So I have to be very careful. So I
yes.
went in and I told the regression therapy, I'm like, okay, I'm going to try these. So I did right the water up to here, and it did change the timbre of my voice. And she could tell the difference. So the accent didn't disappear completely, but it was my voice was relaxed.
Yes.
It was, and so I decided this is my new experiment is I'm going to use hot towels.
Or a heating pad.
That's right. To see if I can do the relaxing of the vocal cords to see if I can make it sound better. So maybe you're going to be seeing this on YouTube video. I once also do the metronome. I'd use the metronome to get my flowing speech better, is to
I've
have
heard about
metronome.
that. I think I watched your video on it, but uh, I don't have a metronome. And like you asked me when a lot of people think I'm Scandinavian. Once again, it's the blonde hair, blue eyes. I look like a good Viking girl. And um, and there's a lot of sing-song in my voice, which is why the speech therapist, she's like, you got the Tarzan, it goes up and down all the time. And
Yes.
because I can feel in the back of my throat, if I'm going to get my real voice back, I can feel the muscles release. And sometimes it hurts when the muscles release, only because, yeah, like I told you before, it's like when you're holding groceries real tight in heavy bags, and then you have to like peel your fingers off
Yeah.
afterwards. That's kind of what it feels like in my throat. Like as somebody has to, it
So
hurts a little bit when it stops because it's been years now in spasm.
I'm learning so much from you. So I don't have metronome either, but I have metronome app.
I see. I got
So
it.
and I do and when I can speak mm, little bit I can do better for like 4 or 5 minutes. And
Yes.
it's
It's
so
very,
exhausting to do
it's meant to
this.
be exhausting as well because you're trying to control it. And I tell people, like I'm supposed to go get a blood draw for all the, things that got wrong with me. And I tell them, I said, look, don't do it right in my arm joint because if I spasm, we're going to have trouble. And so they do it in my forearm. Sometimes they do it on the back of my hand. But I tell them, I can only stand still for so long. I said, and 3 times now, they've had to help me out of the clinic from where I get the blood drawn because I'm spasming all over so badly just from trying to hold my arm still because they need like 6 vials of blood. But they
Yes.
also now use this, what they call a butterfly thing. And it's
Yes.
got a little, so that if I move, it won't, that's why I
Yes.
said, don't do it in my elbow because we could have big trouble. But if they do it someplace else and it has that little tube on it, then we're good.
And
And
not a metal tip. It's not, it never stays in this.
yeah,
This is what I have lots of experience in the hospital in the last year or so.
yes,
It
unfortunately, so not in the last year so much because uh, I think it's really settled down a lot since I came with this voice, like I don't very often sound like a Down syndrome person or a deaf person talking unless I'm having really bad full body muscle spasms, because then everything's going haywire everywhere. And it's not just the FAS.
Yes. So yes, because so I'm learning that the FAS for me is from we assume from the stroke. So I
Right.
have problem in my left brain, which is
Mm.
the aphasia, which is where word finding, language I can understand language. It's difficult to communicate from my brain out my
Yes.
mouth.
I told you
And
some
I
of the
have
words don't work.
it's called apraxia, is in the different part, and the apraxia is the mechanics of speaking. And so you could there's a video of me trying to say the word canine, and I was like kanan, kanun, kana, like
Well,
and,
yes.
and that's apraxia. It's just my brain is like not going to give me the mechanical part of being said the word. And I'm learning the difference between what is aphasia, the apraxia, and now I'm also thinking more about the vocal cords. And one of the reasons that you gave me a tip about breathing. And you say, if you can just say something about bronchial spasms, you tell
Yes.
me the story about bronchial spasms.
Okay, so I kept having all of these asthma attacks from allergic reactions. And I go to the ER, and because my inhaler doesn't work, nothing works. And so what happened is they send me to a pulmonologist, a lung specialist, because they said you're having bronchial spasms. So they tested everything in my lungs. Oh no, your lungs are in great shape. And so when I'm in speech therapy, because a lot of times my sometimes my inhaler will work because it's an allergic reaction, and then it is asthma. Asthma, you cannot breathe out. No. Yeah, you can't breathe out. And then there's another thing called vocal cord dysfunction. And that is where your vocal cords slam shut like this, and you cannot breathe in, which is why the inhaler is not working. But when I was at the speech therapist, this happened in her office. And I tried the inhaler, not working. I'm like, and she's like, I know this sounds counterintuitive. Take everything you have in your lungs and make the F sound as hard as you can and breathe out, and it will force your vocal cords open from the inside, and you'll be able to breathe again. So they are both triggered by allergens. So but she said it's a life-saving technique, and she goes, I've never seen it work. But when I got my voice back, it was really, really deep. I mean, I sounded like, a man. I did not even sound like myself, but it's because I had such severe, tight and then force open. The forcing made everything in my chest change too. So then it was a lot of change.
I feel you may have lost saved my life. So I have been under test for the last 3 months because I keep saying I'm so breathless and for no reason. It feels like
Yeah.
no, and I've been walking with hiking poles just because when it happens, I'm like weak I can't get my breath. It's very bad. So I do all the pulmonary tests. I have all the lungs perfect, breathing perfect.
Yes.
It's all
Yes.
good. They're doing heart tests. Everything seems like it's going back fine. I don't have heart problem. You told me this. You told me this. And it happened. So, and I'm also allergic to everything that grows and if it has fur. So I, my whole life I've been there. If I can, anyway. So I'm allergic to, and June is my worst month. Because everything's in Canada, in Calgary, it's just blooming and
Of course.
the pollen. So you tell me this trick, and because it's hard to not panic.
I know that's what my
It's like,
mom keeps going. Just calm down, it'll go away, because some people get asthma attacks from panicking. And I said,
yes,
it's not panicking. I'm not panicking. I said, I just can't breathe.
yes, it's very, yes. So, but I can see why the not breathing triggers a panic attack. I understand this because it's terrifying to not be. So I started doing this. Now the F word this, or the F sound is not working for me. For me, it's going shh.
I think it's a similar thing. I think it has to just basically be something that causes you to out. You know what I
Yes.
mean?
Oh my God, I feel like you have honestly saved my life because I have been able to do this like 4 times since I just chatted with you for a couple days, and it has changed. And now here's the thing, because a pulmonary person or my heart person isn't going to think about the vocal cord spasm. They're not going to think about this. It's a This is my problem with all the doctors. They only have their own specialism, right?
Oh, of course. And
And
that's
but
why I was at the speech therapist when it happened. And so that's why she's like, oh my God, I've been telling people to do this for years, but I've never seen it happen. And
I'm
she was
so
so
excited.
excited. But it saved my life so many times in the last 8 years, because I think I stopped seeing her about 8 years ago. And it's crazy. And honestly, trying to get into all these doctors' offices when I sounded like a deaf person or down, like some people ask for my mommy, and I'm like, I'm 40 something years old. I don't live with my mommy. And
Yes.
I said, just do what I say, because I needed, I had a mask with
CPAP?
medicine. No, no,
Oh,
not CPAP. For asthma, like when they go to the hospital, it starts with a V, I think. It's not a ventilator, but it is a something. No, it's the word is escaping me. But
yeah.
anyways, if you have as severe asthma, you have a home kit and they put medicine in it, and you can either have a tube to breathe in, or mine, because of the spasms, I couldn't always hold the tube. I had a mask. And but I noticed there was in the filter mold in my kit. God, what the hell is that thing called? Anyways, I mean, I could bring it to you and show it to you, but anyways, uh, damn it. Anyways, and I always want to call it a ventilator, but it is not a ventilator.
Right. Yes.
And it even come to me eventually, the name of this. Anyways, they wanted to make sure, because I had to keep going to the emergency room, and they said, why don't you have one at home? Why aren't you using it? I said, because the insurance, they have not approved it. And I mean, I was using it before I found out about the letter F. and being able to stop it. Now I don't have to use those steroids hardly at all anymore. But
It's
back
so
then,
good.
I was 5 to 8 times a day using it to breathe, because the medicine releases everything. It opens up your blood vessels and makes it so that you can speak again and breathe again. But you shouldn't have to be on that stuff all the time, because it's not good for you. It's supposed
Yes, this is.
to
Did you
emergencies, but
did you
basic,
have an allergic reaction towards steroids? Did you say this?
I did, because I was having these conditions, and the first thing is that my whole neck broke out into hives. I had
Yes.
hives from here to here and across my chest. And I was not putting anything on it, but they wouldn't go away. So I was taking some medicine that my doctor had told me before, the dermatologist had told me for hives. And she said, I give you a stronger one. It's the same thing. She goes, but that's an old drug. She goes, everybody forgets about it. You're right. It's great for hives. I was on that for 8 years.
Oh,
But eventually, after 2 years, the bumps weren't there, but I looked
yes.
like I had a permanent sunburn, just on my neck and chest, not on my face. But then,
Oh
the
my God,
allergic,
you're freaking me out.
because so she gave me Allegra, and I'm allergic to Allegra. And she looked at me and she goes, what do I do with a person who's got allergic reaction and is allergic to the allergy medicine? So she sent me to the allergy specialist, and he is one of the professors at the UCI. Yeah,
Yes.
in Irvine.
Yes.
And luckily his office is right around the corner. But my knee swelled up because, like I said, it started with my ankles getting severe tendonitis to the point I couldn't walk. And then my knee swelled up, and it was like the size of a cantaloupe. And so my doctor, she's gave me an long-term, 3-month injection of steroid in my knee. And I could not breathe. I was so terrible. I thought I had a really, really bad flu. And when I went, and because I kept going, I can't get the thing to work. I can't do this. I can't do that. I can't get it. I can't stop. So I go and see the allergist, and he gives me medicine. And then I came back 2 days later, and I'm literally leaning against the wall in the chair. And I'm like, look, I can't even sit up. I'm like, I can't breathe, And I said, first, I go, my poor husband, he has to take care of me because I have this terrible flu. I get my knee swell up. I get this, big injection in my knee, and then I can't breathe, and I have this terrible flu. And he goes, oh my God. He goes, you're allergic to the steroids. And it never occurred to me or him. And so he gave me steroids, which is a normal treatment to get rid of allergy problems.
Exactly.
And
Yes.
so he goes, I gave you more of what you were allergic to. But even though I got the injection in my knee, the allergic reaction settled in the cartilage of my chest. I couldn't lift my arms.
In your cartilage in your chest.
Yes. And that's
Oh my
where
goodness.
it's like, for 3 months, it was so painful. I would take a shower, I'd wash my hair. I have to have my husband get me out of the shower and brush my hair, because I can't lift my arms that long because it pulls here. I couldn't wear a bra. I couldn't have a seat belt go across my chest. I mean, I was in so much pain, and for 3 months. And then he said, as soon as this is over, we're going to, it looks like snap tape, and they put all these different allergens in these things with like Vaseline, and they put them all in tapes down your back. for 48
Yes.
hours. And so when he takes it off, he says, he goes, you have allergic reaction to 2 different fragrance profiles. And you think, oh, perfume, you know, which I've always had a problem with perfumes my whole life. I hate it when you go in the stores and they spray you. And this list, he goes, there's about 200 things on here you're going to need to avoid. You can't have any of them for the next 3 weeks.
Did you say 200 things?
Yes, because things you don't think about. Every single spice, I could have salt and pepper. That's it.
Oh my goodness.
Every other spice was out. Cinnamon, paprika, garlic, everything out.
So any food is out.
Every citrus, almonds. And if you think about it, because like Vidal Sassoon, they always had almond scented shampoos. And he goes, and I'm going to tell you something. He goes, unscented is a fragrance.
Yes.
He goes, it's a masking fragrance. And he goes, and you'll be allergic to that one too. Well, I went home to take a shower because, you know, I had this stuff on for 48 hours. Immediately, my head blistered from my shampoo that I had been using. I went to put on, I had been using my oil of Olay, which was supposed to be an allergic friendly, you know, allergen friendly. Blistered my whole face, blistered my hands where I put it on. I'm allergic to sunblock. I'm allergic. And so I told him, I said, do you know what I've been living on? Scrambled eggs. And because I couldn't have citrus of any kind.
Right.
I mean, all these things on the vinegar was on the list. Tomatoes. I said, I'm making a spinach salad. I said, I reduced cranberry pomegranate juice until it was like a syrup. And I used that with olive oil. And I made a spinach salad with chicken breast with no seasoning on it, and avocados, and one other thing. Oh, and feta cheese. And he goes, well, that sounds very gourmet. I said, for 3 weeks. It is all I have eaten for 3 weeks. I said, and do you know how long it takes to reduce that stupid pomegranate juice down because I couldn't have any of the citrus ones, you know? So it was crazy.
Are these things attached to your diagnosis of dystonia?
They all hit me all at once. And so it's really hard to tell because I'm going from like one doctor to the next, to the next, to the next. And now I'm seeing the pulmonologist, and now I'm seeing the heart specialist. And honestly, I had to see the heart specialist because my brother had a quintuple bypass. And then his was genetic. And because his was genetic, my sister and I had to be tested to make sure we did not carry the gene as well. But so I wasn't actually sent there for all of this stuff. But the doctor that I have now, the neurologist, she goes, every time you come here, she goes, your heart rate is so high. And I said, it's because even if you can't see it, I'm having spasms all up and down my body. It makes the blood not flow easily. And she said that she's concerned I will run out of heartbeats, is how she put it. She goes,
oh, don't say this, because Erin, you're lovely. So don't say this again.
Well, I've outlived my dad and all the men in his family and all the women as well. Most of them died in their 40s. And like I said, all of my grandparents had died before I was born. So I never knew any of them. But so I don't know enough people on the Polish side of my family to know if there's other people that have this. And it is on the same spectrum as Parkinson's and gets misdiagnosed as Parkinson's all the time.
Because of the spasms.
Because of the spasms and the shaking. But you can have both Parkinson's and dystonia at the same time. It's not that uncommon. But
So,
but
and what in some ways, the FAS, the foreign accent syndrome, is one of only one little part of what's happening for your body.
it is. And I told everybody, I said, you know what? I know that for you, you hear it and you're like, oh, you're so different. I said, but for me, it's the least of my troubles,
This is, it's fun. I'm just starting to arrive this to the same, because it's the obvious one. It's the thing that people notice is my
Yeah.
sound of voice. And because, just for context for the people who have never really heard about me, is I was a preacher. So
Really?
I relied on my voice. I was public speaker. So um it's very obvious for people who have. I had a woman come to a concert about a month and a half ago. Literally, she would not respond to me. So I'm there with two other friends, and we meet this other person, and I start speaking. I ask a question, and this friend of mine started responding to the other two friends, but she would not actually have conversation with me because she was so freaked out. She was so freaked out with the sound of my voice. It took,
Yes.
and then like literally my other friend kind of made a joke and said, I just want to reintroduce this, my friend Tara, to you. Like, because she was responding as if I'd never met
I know.
her before, and I knew her. It
Yeah.
was freakish.
It,
But
it, it is interesting.
it is the um thing that notice. I understand that my body is going through a whole bunch of new things, right? I know this. And I
Yes.
know also that I have, because of my stroke, that I have unseen disabilities that I'm
Right.
aware of.
Of course.
But you don't see those. You see the
Of course.
foreign accent syndrome because
Yes.
this is the one that you notice.
Exactly. And I mean, for me, I get a lot of spasms in my face, and like my face would droop on one side. And people will say, oh, you're having a stroke. I said, not having a stroke. It does make me sound funny, but I have to tell them, because I used to go to aquatherapy in the swimming pool 3 days a week. And when I graduated out of being in a hospital and being in with a class, I didn't really know what to expect. First, I had gone to a class for neurological patients. And so I thought that they would be like, what is it, like cerebral palsy and things like that. No, most of them were car accidents, and they had surgery, and they're, doing stuff. So I'm the only one who really is like, doing all this stuff. And so I'm the one in the class, and the teacher, she was, now tell everybody where you are from again. I forget, you told me. I said, I am from Huntington Beach, California. And she looks at me, she goes, no, that's not what you said. I said, yes. I said, that's where I'm from. And so that's the first
It's so
time I had
funny.
tried I was in the warm water and had tried submerging my face down to here, because they had kept you walking in shallow water. And to do these certain exercises, we had to go down to the deeper end. And then I could, because
Yes.
there were so many short people in the class, there wasn't enough room in the shallow end. So I had to be farther down.
You're a Viking giant.
And I'm
Yes.
not that tall. I'm not. I'm just under 5'8". But it's hilarious, because especially when I get my voice back, and you know, they know now. And I did have to, every time when I moved to Oklahoma, none of these people have ever met me without an accent. And
Yes.
so it's in some ways much easier for the last, 4.5 years that we've lived here. We moved here right before COVID. And the ladies at the front desk one day when I'm waiting for my husband to pick me up in the wintertime and they said, okay, we all have a bet out here. All the different ladies who work in the front, where are you from? And I said,
Oh.
and I told them, and they're like, oh my God. I said, so if you don't see me for a while, it's because I'm having some major spasms of some kind. And which I told you that I had fractured my spine from spasming,
Yes.
and I had torn my rotator cuff, and excuse me, and I was out of the pool for a long time. And I've been out for a long time now because in December I got severe vertigo, and to the point where I couldn't really walk at all. But the gist of it is, sometimes still 6 months later, I could be walking down the hallway, turn my head, and everything starts to spin. And I don't know. They said sometimes when you get to a certain age, I'm like, please don't tell me it's because I'm old. You get to a certain age, and there's crystals like in your ears, like they shift. And
Yes.
so almost every night I get into bed, the whole room spins, like I'm in a flat spin. And I said, you know, being in the pool isn't the problem. Getting from the locker room out to the pool, you know, all the turns I have to make and stuff. I said, that's a very hard surface to fall on. You know, I said, so I've been staying at home. I know God has not given us a spirit of fear, but honestly, there is some fear. I mean, living in a small house, there's always like a wall or a chair or something nearby, and I've never hit the floor. Because they used to call me every month. Okay, have you been to the hospital? Okay, have you fallen? Okay, have you done this? And they have all these lists of things, you know, has your medications changed? Blah, blah, blah. And all these questions, but one of them is always, have you fallen? I said, I've never hit the floor. And
I want to ask a question about this. I want to wrap up the time, and I want a couple of things about foreign accent syndrome. But before we start do the ending, I want to know, Erin, how you are dealing with the fact that your body is rebelling against yourself mentally. I want to know how.
I'm going to have a big conversation with God when I get to heaven. I'm like, what the hell? You gave me a very defective model. Okay.
Yes.
And
Yes.
yeah, because it really is when you can't always say the words that you want to say, but will say that I do watch a lot of, because I'm home a lot, and I was an artist. I was a fashion designer. Now,
I noticed that in the corner of your room. What is it called where you put the
mannequin,
clothes? What is
my
it?
mannequin, my mannequin.
I
It's a dress form.
I saw that dress form, but
Yeah,
you you
put all
can't do
sorts of
this?
junk on it. Huh?
Yeah. You
It's
can't
because
do this?
I was a fashion designer. I designed surfwear for a number of years. Being from Huntington Beach, the surf
Yes.
capital of the world, it's a really good place to be. And later, I designed a lot of costumes for the ballet, a lot of ballerinas, and then we also did dance schools and stuff like that. The Aquarium of the Pacific, they do this nighttime thing there where you have dinner, and they choreographed. They told me they wanted California fish and sharks to become friends. So I had to make costumes that they were at the sharks had their long silver gloves, and they were strapless with teeth on them. You know, they were still designer, very chic ballet costumes.
Oh, so
And the
beautiful.
fish I did the California Garibaldi, which is very, very orange, and some other fish from California that are off the coast right there. And they do this, I think they still do it actually, at the Aquarium of the Pacific once a year, or for a show or two as a fundraiser. And they do this, the fish and the sharks and all these costumes that I designed. But, you know, I'm a creative person, and now my mom's like, you don't write thank you notes anymore. I said, Mom, I have to focus so much on my hands to write. By the time I get to my signature or to write on the outside envelope, sometimes I write the outside envelope on a different day because I can't write I said, I only can concentrate for so long on controlling my muscles. But I have managed to paint a couple of costumes. But for the most part, I really can't do like you said, you can't do the same job that you were doing before, although you could still preach with an accent, you know.
Oh, but yes, but anyway.
Well,
Yes.
okay, here's what I find interesting, because it's not a true accent, right? I'm not
Yes.
from another place. Even if they think I'm from Scandinavia or England or even Canada, nobody's ever said Canada though. I get a lot of Australia. A lot of people think I'm from Australia. Mostly it was British Isles or Scandinavia until I
Yeah.
came to Oklahoma. For some reason, they're some of the only people that asked. I only had one person ask me before if I was Polish. I said, actually, I am,
Oh,
but I've never spoken to anybody Polish, who has a Polish accent. But here's the thing I noticed. When I watch British television, they put the accents in different syllables, and
yeah.
they say words differently, and they don't have the same slang that we have. And so
Yes.
that is one of the things that, like I told you, I spoke with somebody on the phone. He's like, you could tell you're really an American because you use American slang correctly. And so
You have to be very careful with doing British slang, because there's a word that everybody in Britain works all the time, starts with the C, and it would be demonetized in YouTube if we use it. So
demonized,
yeah.
demonized,
Demonetize. Ooh, look
demonetized.
at that. I can do big words now. I
Yes.
want to talk about I just want to rip. So you had a life, a beautiful, creative, productive, beautiful life. And then your body said, "Beh, I'm done."
Exactly. Kind
And
of.
you said, and you had, I understand that you've had this um, re relationship with God where we're grateful. We say, "Oh, thank you, God, for this." And but it also gives you permission to go, "Are you effing kidding me, God? This."
Oh, believe me. And we've been there so many times because
Yes.
this is only one of many things I have been through. I've had my knee rebuilt and had to learn to walk again, and it took a year. And all this other stuff, things that other people don't do. And, like maybe you would have one thing like this in your lifetime, but me, I've had my whole life has been one after another, after another, after another. And yeah, you
But
do question God.
oh, for sure, I understand. I
But
understand. I was a
but
priest. My goodness, I understand this.
but we
And
have
I
to
used
say,
to. My joke was, I've always said, you say, okay, God, not one more thing. I can't do one more thing. And God says, huh, sees
Well,
that as a challenge, right?
and actually, I have this. It's a quote from Mother Teresa. It says, "God said He would never give you more than you can handle, but I wish He didn't trust me quite so much."
Yes,
And
that's right. That's
if
right.
Mother
I
Teresa can
understand.
say that, and that's what I say, because I'm like, really, this is what like when I tore the rotator cuff in my shoulder, and I couldn't pull up my pants. I couldn't. The worst thing, I started eating because it was my right arm that I write with everything, and I couldn't eat soup. I couldn't eat salads because the coordination on my left hand wasn't good. So I fell into this. I can cook things in the air fryer. I can eat chicken strips, and I really, the interesting thing is I've become quite good with my left hand because it took 2 years to get this to heal. And so playing ball with the dogs, because they were both puppies when I got this, and I had to learn to throw the ball with my left hand. That was fun. But yeah,
But
I couldn't.
you still are living the life. You have a life. It is not what you want,
Right.
but you're beautiful. We have
Well, thank you.
conversation, we're funny. You still have the humor and the
Yes,
happiness. We have to be grateful for the abilities that we have to be able to be resilient. Except I hate the word about resilient because I don't want to be celebrated for how well I take a punch. But we
I
can
get that.
we can we can find hope and because the fact that you can still pant up an outfit, it's not what you used to be able to do, but you still have your brain is still creative.
It
So
is, and the whole thing is, it is interesting. Like initially, I couldn't. I was six months of bed rest. I was going nuts. I taught myself how to knit from YouTube videos, and I was knitting, knitting, knitting all the time. But then it eventually got up to my hands, and now, and when it got to my brain doesn't always remember how to put the stitches together, how to move the yarn the right way. And a lot of things you do is muscle memory. And
yes,
if you cannot think about something and do it, then you could probably do it. And
yes,
it's true, because my friend's husband has Parkinson's, and he actually had it before I got any of this stuff. And but he became so self-conscious. The more self-conscious you become, the more you freeze up. And he's on the ground spasming. She goes, he's over 6 feet tall. She goes, I'm 5'3". I don't know what to do with him. I can't pick him up. I can't help him. She goes, but the more self-conscious he became, the worse and that is also what all of the doctors have told me, even with the FAS. Your accent becomes stronger the more people are pointing it out to you.
yes,
And when I get out of the pool because my face starts doing something funny, or for me, it's the middle toes on my feet try to cross, which of course they're too short to cross. But when they start doing that spasm, I know I'm going to be in trouble soon. And so I better get out and take some medication. Or sometimes they will spray some cleaning product in there, and the aerosolized anything will give me the asthma, or actually not asthma, but the vocal cord problems. And it's crazy, being out and among people. I will say, moving to Oklahoma, they say I have no more allergies. Now, he said, I can't test your vinegar allergy because that's too weird. He goes, I would have to pay hundreds of dollars to get something in here to test that. He goes, but you know, so I think part of it is being away from California. A lot of that, because they're all different grasses here. There's all different trees, all that stuff, because I had such allergies. Like you said, the pollen, when the
Yes,
pollen in California and the pollens that I get in Oklahoma are completely
different.
different. So I have never had the problem of being exposed to it for so long that it makes me because they tried allergy shots on me and I couldn't make it past one. They had to give me epinephrine every time they gave me a shot, and so they gave up.
I
So
want to, you have given me, you are just like a wealth of information. And the way that you tell your story is not just, this is the awful things that my body's doing to me, but this is how I figured out what I can do on the
yeah,
other side. I want to, we're going to have to wrap up. Oh my
of course.
goodness, I can't, I want to cry. I'm so happy that we've been able to have this conversation. And I wonder if in the end, if ending, if you have anything kind of words for hope of other people understanding a foreign accent syndrome doesn't seem to, it's never in the context of the people I've talked about, it's never one thing. It's one of the symptoms of something else. Is there
Yeah,
hope? Is there
there is
something
a
that you
bit.
can tell us hopeful about kind of life with living with foreign accent syndrome for the other people who are going to be watching this video, looking for some hope?
As far as like doctors go, the one of the things I actually really hoped, because there was a clinic for foreign accent syndrome in Texas, and I would have been within driving distance of where we live in Oklahoma. And I was so excited, but it shut down because there's not enough patients. There's not enough people worldwide. There's only roughly 200 of us worldwide. And so, like, when my neurologist in Oklahoma, she goes, I've never seen somebody with this condition before. She goes, I'm going to try and send you to this specialist. And he's the one who told me that I taught myself how to do this. And I'm like, thanks, buddy. But my neurologist was horrified. She goes, I thought he was going to be helpful. She
Yes.
goes, I am so sorry. She goes, I wrote them this. I said, you know what? Before he even had my information, because I wrote everything down, they took me into his office. He had already decided that I had made it up. And he said,
Yeah.
you know, I go, then how do you explain when I get in the jacuzzi and go to here and get my voice back? He goes, you taught yourself to do that too. I said, I must be really flippin' brilliant. He goes, it is. He goes, the people who have this are very, very smart. And I'm like, oh, thank you. But
Oh my goodness. Oh my
but
goodness.
it is crazy. But in the end, your accent really does not define you. It doesn't.
Yes.
It is but it and maybe it's Americans more than other places. Like in Europe, they're used to other people with other accents being close by. Like in the States,
Oh.
you know, you don't get that big, you have to go a long ways to find somebody with a different accent.
Yes,
But
this is true. Yes.
so Americans always ask you about your accent. I said they're fascinated about people with accents. And I find this quite interesting. So I don't mind. I think we had decided when I found the Foreign Accent Syndrome group on Facebook, it answered a
Yes.
whole lot of questions for me. and then meeting
Yes.
other people who have been through it. But when it's the last of 8 specialists that you've seen that says you're making it up, I'm like, well, talk to the other 7, okay? Nobody else thinks I'm making it up. But it's, you know, and there might be somebody out there who thinks that all of this is a bunch of malarkey, but really, I don't care. And I think that's one of the things that has really, as a fashion designer, I don't care what people are saying to do because I have to come up with the next thing out there. So when people tell me this is what's in style, I'm like, yeah, whatever. Because I don't care what's in style now. I need to know what the next thing is. So I have this attitude, like, unless you could
Next
give me
thing.
constructive criticism, you know, a way to help me one way or another, that is the only thing, you know. But I also have to believe that God has not given us, what is it? Now I just forgot my verse that I stand on, that all things work for the good for them that believe. And so that is where my hope is. Somehow this is working for the good. You and me talking, letting other people know you're not alone, you're not making it up, you're not crazy. You know, maybe that is why God has said, I will send you.
Yes, I think Erin, you sent it to me. I've been sent to you. My dog is very happy that we've gotten better. We've met. This is all very good. I'm very excited. Thank you so much for taking all of this time. And I'm going to be posting this on my YouTube channel. I talk about foreign accent syndrome, different aspects. This is the first interview. I'm excited that it was you, Erin. And I really hope that we gave you some information that you didn't know, especially I'm going to post this to the Foreign Accent Syndrome private groups and the public groups. I'm very excited because I'm going to look right in my camera and I'm going to say this to anybody who has Foreign Accent Syndrome. And can I say there's more than 200 people like this? I believe you. I know this is true. And there's hope. There's hope.
Now, there's my dogs too. I took their squeaky ball away at the beginning.
I thought mine was in the kennel, but she was being so quiet. I didn't know that the door was not closed, so she escaped.
Mine are at my feet, and every once in a while you'll see the camera jiggle because I put it on a tripod in case I
Yes.
start to spasm, and so that
Yes.
you wouldn't look like you're having an earthquake on your screen. But yeah.
Okay. Erin,
Now,
I thank you. I'm so grateful for you. You're so a beautiful human and a
thank you.
beautiful human being. And thank you for uh, telling some very difficult stories and to helping us find some hope.
Well, it's been a pleasure. It's been a pleasure meeting you, and like I said, I hope we're helping other people out there that are having a hard time.
That's right. Thank you so much for taking your time. Bye, Erin.
Bye.
Bye.